Can I take care of my anxiety before I take care of my obsessive compulsive disorder? Oh, there's a lot of ways to go with that. Let's talk about a couple of things historically. Number one, it wasn't until the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, the 5th edition, where OCD was separated out from anxiety disorders. So up until DSM-4, everything was all kind of in one category. They moved OCD and related conditions out from anxiety disorders into its own category. This does not mean that OCD does not have anxiety involved in it. It absolutely still does. It was more of a look at genetics and medication treatments, and because the DSM is more on the medical side than the psychological side, it focused more on that area. But if you think more from the psychological side and treatment, exposure and response prevention therapy is the types of therapies that we do for all anxiety disorders. They may have some different names. If it's panic, I do something called interoceptive ERP, which means I expose you to panic symptoms. We might do things like running in place and hyperventilating and breathing through straws and spinning in a chair. If you have social anxiety, we're going to do exposures to social situations and have you do response prevention, which will likely mean not having a drink before you do something social or staying in situations even if you're uncomfortable. If you have post-traumatic stress disorder or PTSD, they've moved those out of the anxiety disorders as well too, and they've created the trauma disorders. But there's still an exposure and response prevention type of therapy there called prolonged exposure, where you have people purposely exposed to the memories of the traumas and you have them repeat the stories of the traumas over and over again to learn that they can handle the memories. So in the core of all of these conditions is exposure and response prevention, where we're purposely exposing things to people that are uncomfortable, and we're having them stay in the situation without doing the safety behaviors they would normally do. And let's quickly review those safety behaviors. 1, avoid everything you're afraid of. Number 2, ask everyone you know that you're going to be fine and everything will be okay. So tons of reassurance. Number 3, if you do have to do something uncomfortable, distract yourself as much as possible. So get your phone out and watch a YouTube video or something like that instead of paying attention to what's going on. Number 4, people jump to substance use as a way to try to neutralize all of the feelings and thoughts going on in their head. And number 5, compulsions for obsessive compulsive disorder. And if we do those things, what we learn is, as long as I do those things, everything's fine or okay. That's what the problem is, though, because then people's lives are overtaken by safety behaviors and they don't actually learn how to manage what it is that's going on, whatever the anxiety or OCD might be. They learn, I'm okay as long as I do a safety behavior. And if you really want to work on getting your life back, we help you eliminate the safety behaviors you do, and we teach you that you can handle being uncomfortable. Uncomfortable is not a 4-letter word. It is not bad. It's not awful. It's not horrible, and you can handle it.